Hi, I'm Trish Levitt. I'm a Gundungurra woman from the Southern Highlands in New South Wales. First of all, I'd just like to acknowledge all countrymen and countrywomen and acknowledge my brothers and sisters out there and pay my respects to all of you during this meeting.
Yeah, today we're going to be talking about a project run by our team here at the Aboriginal Medical Service in Wollongong, the Illawarra Aboriginal Medical Service. Trish Levitt, the Aboriginal health worker on the cancer care team, Kyla Wynne, the counsellor on the cancer care team, and myself, one of the GPs. I'm also based at University of Wollongong. So it's basically a project that we were funded to do from Cancer Australia in collaboration with a few members of your collaboration. Dr. Michelle Dixon and Emma Webster is also from University of Sydney, and along with the AHMRC team, Kate Armstrong, Lee Bradfield and Imran Mansour are based there. So we've also been working with the Menzies School of Health Research team, Gail Garvey, Joan Cunningham, Lisa Watt and Abby, who've done a lot of work in the area of cancer, and also with PHN, and recently Janelle Treese, who is a GP who based in Ballina, has joined our team as a medical writer.
So I'd just like to explain a little bit about our cancer care team and how we actually came about. So our previous CEO was actually diagnosed with breast cancer, and she found a massive gap within the health system, and so she actually went searching for some funding. We're actually funded through the RDN. We're a unique program. We're it for Australia in the way that we work. So we do educational programs right through to grief counselling, and beyond that, helping people rebuild their lives.
So the aim and objectives of this project now is to evaluate the need of the cancer care training materials in ARCHOs in New South Wales and report on case studies for best practice in cancer prevention and cancer care in New South Wales. We want to develop a training manual and training modules to support the ARCHOs to deliver best practice for cancer care to Aboriginal people, including QI programs, and to pilot and evaluate these resources. So our expected outcomes on this is to have a training manual and online modules to support ARCHOs to deliver care for Aboriginal people with cancer from prevention through to treatment, palliative care. Also supporting preventive programs, supporting people through evidence-based care and care through to palliative care, advanced care planning and grief support. So some of the opportunities and considerations for this is opportunity for quality improvement recipes, QI case studies in the use of electronic medical records. Also, so they may lead into other QI projects to translate into improved outcomes, and additional in-kind support for staffing of AH and MRC will enhance this project.
We'd really like to acknowledge the support of the AHMRC, and we realise the work that goes on in ARCHOs around New South Wales has been really a big part of their work. And so a big part of this project is about quality improvement in our own cancer care program. We've had some quality improvement initiatives, including looking at cervical screening and mammography, things like introducing a yarning circle, and also improving care for people at the end of life. So we're really hoping that this training module and the training manual will support ARCHOs to be able to institute quality improvement projects, including use of electronic medical records such as Communicare to improve their programs. So yeah, we're really looking forward to working with our whole team. We're actually doing some interviews at the moment around New South Wales with some of the ARCHOs under the AHMRC network, really to share stories about some of those other good stories about what people are doing, and progressing with writing of our materials at the moment with Dr. Janelle Treese and of course Dr. Michelle Dixon on the team as well. Thank you.